Coming up in 5, interview with Dr. Adrian Rhudd, Consultant Urologist, Mount St. John's Medical Center. We're looking at men's health generally, and I have a couple of questions for you. So men in their 20s, what are some of, and I'm looking at the long age, so 20, 30, what are some of the issues I should be concerned about? And then 40 plus, what are some of the issues I should be mindful of?
Okay, so younger men, first I'd like to say all men have a prostate. Younger men tend to not have to worry about cancer, which is what people usually relate to when they hear the prostate. Younger men tend to have issues with infections, sexually transmitted infections, particularly one type of infection called a prostatitis. Prostatitis is fairly difficult to diagnose and treat and is usually associated with a number of signs and symptoms like burning when you pass urine, going to the toilet frequently, pain down by the prostate or behind the testicles, or just an uncomfortable feeling. Because the prostatitis can present in many different ways, it can sometimes be challenging to diagnose. Some men may even notice blood in the semen after ejaculating. Some men may have blood in the urine. All these things can be a sign of prostatitis. Prostatitis is one of the commonest diagnoses that young men present with to us urologists. So that's what I would say, particularly for the younger men, to look out for with regards to the prostate.
Mm-hmm. And if I'm over...
So once you hit 40, the concern is for prostate cancer. Generally speaking, if you are black or of Afro-Caribbean descent, or have any first-degree relative, a father, uncle, brother with prostate cancer, you're high risk for prostate cancer. And we generally recommend screening from age 40. Generally, the Caucasian population of patients with no family history, they tend to start screening at age 50. And by screening, I mean a digital rectal examination and a blood test, the PSA. That's the first step in trying to determine if there is any cancer in the prostate.
So generally men have this phobia about this rectal digital examination. What are some of the things you would say to create that awareness in men that this is important?
Well, I would say that it can be life-saving. I would also say that currently in 2020, most men have accepted that they are responsible for their health, and in my experience and in my practice, most men understand the benefits of doing it and have the examination done. It literally takes 2 seconds. So it's not painful, it's not uncomfortable, it's unusual, but it can be life-saving. So these chronic non-communicable diseases are particularly hypertension and diabetes. Globally, this is a major burden. These are things that are as a result of the diet and lifestyle. If you exercise, you lose weight, you adjust what you eat, you back off the sugar, you're less likely to get these things. Now, these are the things these are the habits which you start off with from childhood. If your parents are accustomed to feeding you these things, you grow up doing it, and you only turn up when you are 30, 40, 50 with the result of a bad lifestyle of 20, 30 years, and it's very hard to correct that in 30 days. A lot of people think they can adjust their diet in a week, change what they're eating in a month, and reverse everything, but it doesn't work like that, unfortunately. We do have medications, a lot of us have to put you on blood pressure medications, sugar medications, we can give you lots of medications that exist out there. Nowadays, a lot of people are skeptical. You don't have people that will say they don't want to be on medications, they won't take medications. The truth is, I like to tell all of my patients that medications are toxins with beneficial side effects. If you can stay off of the medication, please do. But if you've been eating badly for 20 years and you turn up with hypertension, you have a lot of work to change your lifestyle, your diet, to get off of that medication. Being without that medication and leaving your blood pressure uncontrolled puts you at risk of heart attacks, strokes, erectile dysfunction, and renal failure.